Welcome, everybody. It is May 26, 2020, and the United States is now passing the 100,000 deaths from COVID-19 as we are all gathered here today. I've assembled a fantastic group of people, women and men, who were on the front lines and in the trenches of the last epidemic to have a discussion about what we're experiencing today and what we all recall we experienced some 30 years ago. I'm going to ask Dr. Gottlieb to get the discussion started, but before I do that, let me just do a quick intro of our panelists. Many of you who are watching may know them. You may know all of them. They're all very much iconic leaders within the LGBT and HIV/AIDS communities. Depending on where you're looking on your screen, we have Phil Wilson, who is the founder of the Black AIDS Institute. Was very active in getting the Chris Brownlee Hospice up and started during the last epidemic, Chris being his life-term partner. And Phil has, of course, been everywhere around the face of HIV and AIDS, and especially dealing with its impacts on the Black community for more than 3 decades. We also have one of our spiritual leaders, the Rabbi Denise Egger from Temple Kolami. Denise been at the forefront of our community on marriage equality, on discrimination, on anti-Semitism, on hate crimes, but she was also somebody who was a spiritual leader during the AIDS epidemic and continues to be that here today. Diane Abbott is also on your screen. Diane, an attorney for many, many decades, but the first founding co-chair of AIDS Project Los Angeles. First female co-chair of MECLA, the Municipal Elections Committee of Los Angeles, when we had to actually deal with politicians in power at the same time the epidemic was hitting the last time, and one of the co-founders of Equality California. She knows politics, law, and the epidemic. David Kessler, a founder of Progressive Nursing Services. When I first met David, a nurse, but went on to be very actively involved with the Life AIDS Lobby, crafting legislation in Sacramento for our response to HIV and AIDS. He's now become a noted author, publishing numerous books and publications on grief, death, and dying, and taking the experiences from that epidemic into print everywhere. Karen Oakham, journalist, I call her the walking Wikipedia of LGBT history. She, of course, has been following the community now for almost 4 decades, putting down and transcribing her experience, but all of our experiences through HIV and AIDS, through marriage, gays in the military, on and on. Karen has been at the forefront of all these stories. And then finally, and not least, but he's going to go first, Dr. Michael Gottlieb, physician to so many who had HIV and AIDS in the 80s and 90s. And of course, credited being one of the co-discoverers of the HIV virus who put all the pieces of the puzzle together back in 1981 when we started the last epidemic. That's our panelists. There's a whole lot of wisdom here and a whole lot of gray hairs. For those of you who don't know me, my name is John Duran. I'm an attorney. I'm also a 20-year council member in the city of West Hollywood, but I've worked with all of these individuals at the Life AIDS Lobby and MECLA and APLA and elsewhere. So glad to be part of all the discussion. So Dr. Gottlieb, we'll turn it over to you, maybe help ground us in some of the science around COVID-19 and science around HIV and AIDS, and maybe some comparisons or some distinctions, if you will.
Well, John, first of all, thank you very much. Thanks for including me, and thanks for bringing us all together. I think this is going to be a real interesting and useful exercise. I just wanted to start by pointing out some of the similarities of the early days of both epidemics. Watching the news out of New York, some of the apocalyptic scenes of hospitals overrun with COVID-19 patients, and the ICUs, and docs and staff scurrying to take care of patients reminded me a lot of those early days. Patients with pneumocystis pneumonia, in that case, on ventilators in ICUs at UCLA and Sherman Oaks, where we had a AIDS unit, Joel Weissman and Gene Rogalski and their PAs sort of scurrying around from one room to another, caring for 30 people with HIV and AIDS. just trying to deal with the opportunistic infections. It just had a lot of flashback of those days where we could do so little for patients, as was the case in many instances for patients with COVID-19 on ventilators and unable to be weaned off them because of the overwhelming pneumonia. And then the other thing I thought about was how little we knew about HIV. We didn't even know that it was a virus in 1981, and we didn't know that until 1983. And we didn't have a test until 1985. And so when you compare the two, I guess you could say that there's been some progress in terms of science. Yes, testing has been inadequate and delayed, but there was a test for COVID-19 within months developed to detect the virus. So testing, I think, is an interesting issue that maybe we can deal with a bit this afternoon. And the reliability or unreliability of tests, I think I would insert the comment that tests so far are imperfect. And there's a lot of work to be done to improve on the tests that are out there. And then just two more things I'll throw out and stop this soliloquy. Oh, that happened there, John. Your lighting director.
I don't move every now and then, the lights are going to go out.
That's right. Now, the other thing I was going to say is that, at the very beginning of HIV, we didn't know what it took to transmit the virus. I mean, could you transmit HIV by kissing? Could you transmit all the myths and fears of the population about the way HIV was transmitted and not transmitted? I mean, do you have to disinfect your groceries? All these things that we're hearing about COVID-19 from a very distressed population. And then lastly, the issue of treatment. I mean, so little could be done for those seriously ill patients with COVID-19. And of course, in 1981 and the early 80s, there were no medicines for HIV. And so, yes, there are differences in the way the viruses are transmitted. But in terms of epidemics, pandemics, I think there's a lot in common between the two that we all can talk about.
Very good. You know what? You were all there at the beginning of the last epidemic, and I don't know who would like to go next about maybe recent events triggering memories for any of you. And maybe I'll just...
Well, one of the things that strikes me about this pandemic and HIV pandemic is how desperately we needed leadership and how little leadership there was. Who would ever think that a Reagan response to a pandemic would actually be appreciated? That it would have, Reagan's silence was much, much, much better than the misinformation that is coming out of the White House today. But overall, I think what both of these epidemics have in common from a political and from a social science perspective is reminding us how important leadership is. And in some ways, we already see it with COVID-19, how important communities are and where actual responses ultimately come from.
I also feel like there's that sense of, we're not going to get it. They're at risk, not us. That I see now that brings me back to those old days that, and it's only certain people that get it. And we see people of color who are getting this more than anyone else. COVID-19, the same way it was gays and lesbians, well, gays really early on. And that sense of it's not going to affect us, so let's just live our life.
Yeah. Rabbi, you want to chime in?
I think both Michael and Phil and David bring up really important points about who do you trust? And I remember from those early years, you know, we couldn't trust the government. They were saying nothing. It was any information they had was politicized, and that is very triggering. Of course, today we can't even trust our own national government, let alone places we used to look for information. And so, what did we do in those AIDS eras? We created our own institutions to provide comfort and care for our loved ones. Certainly that's what Diane did with APLA. It's to create a network of caring with Project Angel Food, David, to feed people. And I have a sense that on the local level, we have to rely on one another in our local communities to care and provide for one another, and to find the sources of reliable scientific information that we can trust. That was something that was so important from those early AIDS years, as Dr. Gottlieb pointed out. We knew which doctors were on the front lines. You mentioned Jean, you mentioned Joel. These were people we turned to for expertise when there was no expertise with Michael. And so we have to do that, I think, in this time as well.
Karen, Diane?
Well, let Diane go first.
Why? No. Okay. I think there are so many similarities in terms of who do you trust, the government's response, lack of response, but there's also some differences as well. So back when we were dealing with HIV, the CDC would not even talk to us, and we had tried to give them money because they wanted computers. They said they needed more computers, but they wouldn't take it from us. And so I think the fact that the CDC today is making an effort to distinguish itself from the administration and what it has to say is a really, really good thing to have happening. I have to say that for me, when I look at people who are out on the beach, and these young people and how they're just, I'm so sorry, and how they just don't seem to realize that they can be infected. And it's so reminiscent for me of what happened in our community with HIV, when everyone thought you had to be highly promiscuous or a male prostitute to get HIV. And I think then that our young people—
Or live in New York.
Or live in New York.
It's a big city disease.
Right. And so I look at these kids today, these adolescents and people in their 20s, and I have the same visceral response. It just makes me so angry. I just want to scream at them. Put on a mask. And so for me, that's my visceral response to what I see today. And it reminds me of people I loved who did not have HIV and then practiced unsafe sex and converted. It's the same feeling.
Karen?
Well, first of all, let me stand in for so many other people and say thank you to everybody who's on this panel, starting as you did with Dr. Michael Gottlieb, who's partnered with Joel, as he mentioned earlier, to be the first to report this to the CDC. Actually, if I remember correctly, months in advance of the actual published report in June of 1981. But everybody on this panel, I mean, David, before I became an LGBT reporter, David taught me how to care for my friends with AIDS. I mean, as part of that progressive nursing thing that you had with APLA. I mean, I was in a 12-step program. I was freelancing, and I was taking care of people is essentially what I was doing. And after my first friend died, I didn't know what to do. And luckily APLA, I did the AIDS walk. So I found out about David. This is like 1984, 85, right. 86, something along those lines. And I didn't know what to do. I didn't know how to be a care provider. And that was something I had to learn. I still didn't know what to do with grief. I got to go to these 12-step meetings and cry and share my grief and share my anger with other people. And I think that in some ways, that's something that's missing today. I'm greatly disturbed by the fact that people are not with their loved ones when they die. I mean, these images of people pressed up against windows of nursing homes, or, the ambulance is taking somebody away. I mean, I'm glad that there's a tremendous recovery rate. We ought not to forget about that. But we know what that grief feels like. And we know what it is to be at somebody's side when they are dying, to help them die in a way. And the PTSD that's coming from this is just extraordinary. I mean, we have people on Laurel Avenue who every night at 8 o'clock go out and bang the drum, kettles, and scream and yell and say thank you to the nurses and the doctors and the healthcare workers and the first responders. But I don't know how many support systems there are for people who are experiencing the kind of grief that we still experience today. So that's a great concern for me. The other thing that I've been following is the lack of LGBTQ data collection. Scott Wiener has a bill out now, but frankly, there already are some laws that require LGBT data collection. And the reason why this is important is because we're just disappearing. I just posted a piece about the New York Times cover story of today, and I went through 4 pages, 16 columns, and I looked for clues about who among that nearly 1,000 names were LGBT people. I found 5 that could be thought to be gay, if not identified as such. There are 1.7 million LGBT adults in California. We're losing whoever becomes sick and dies from that. We're not going to necessarily have records of that other than their friends and family reporting. In the piece I just posted, I have a photo of the AIDS quilt. These are not just numbers, they're human beings. And we're losing that. We're not going to have a post-COVID-19 data collection, survey. We're not going to unearth all those people. And we know families get embarrassed.
Really good point. I want to, let me open up another issue. Hydroxychloroquine, the president's miracle cure, which now appears to be causing more harm than good, reminds me of the things that we were grasping for.
Wasn't it AL 721?
Yeah, we were for compound Q.
Compound Q.
AZT. We were grasping for anything to try to figure a way to stop the dying. And that's what's reminiscent of what's happening today. And I'm wondering, is remdesivir the new AZT, the monotherapy that's just going to work for a little bit of time to buy us time? Or are we going to have to go through more snake oil from the White House and other areas? Dr. Gott or Phil, or anybody?
Go ahead, Phil.
Well, again, there's a significant difference that's important, between what's happening now and what was happening during the AIDS epidemic. Thank God. And that difference is that while there certainly were people that were out there doing snake oil, and many of the things that you talked about just a few seconds ago, they were treatments that clearly they did not work, but they were legitimate efforts by community at a time when there was nothing, and they weren't coming from the White House. Now, I can't stress enough, how devastating that is when the liar in chief, lives in the White House, when the head snake oil salesman lives in the White House, both of the medical, compound Q and AL, now drawing.
721.
Right. No, I took both of those, and I could go through a whole list of different things that we took. But at the same time, there was a desperation that people were trying things. But I think the tone in which these things were sold, and quickly when we discovered that things didn't work, even folks that, at least folks in the community that were advocating these things, that we knew we didn't know if they would work. We were very quick to say that didn't work. Let's move on to the next thing. And I think that's an important distinction to make, and a lesson that we need to pay attention to this go around.
I want to just add Indel to that, Phil, because in the late 89 and early 90s, I chaired the Institutional Review Board, the IRB, for what was then Research Alliance, Search Alliance, that was conducting some of these clinical, literally clinical trials on these with Paul Rothman, of blessed memory, Dr. Paul Rothman. And what was so important about those is those trials were set up in a really scientific, caring and ethical way. We had a community board, this institutional review board, like you have in a hospital when they're doing ethical trials, to protect the patients and the people who were in the trials. That's very different than a snake oil salesman pitching something because they are invested in a company that produces that. And I think we may need to make that distinction as well.
That's right. I agree.
Let me jump in to say that these treatments that came out of the community, they kept hope alive.
Yeah.
Sure, they ultimately, some of them, they just didn't work, and we needed science, and we needed the discovery of a specific antiviral, AZT, which was imperfect, to set us on the path toward the development of antivirals. And the fact that remdesivir, as being proposed and has been studied for COVID-19, its development benefited from everything that went in to the development of HIV medication. The science in the last 40 years has advanced to the point that at least this company had on hand a compound that they could test against COVID-19 in the test tube that really worked. And then they tried it in patients. And I think that it probably is similar to what John described as maybe the AZT of COVID-19. Maybe there will be more medicines to follow. Maybe there'll be oral medications. Remdesivir, as you know, is an intravenous medication. So it's a start. It points us in a direction. And of course, those of us who lived through this know what the Dallas Buyers Club was all about. And for people who didn't live through it, they can see it very nicely in that movie. And if they don't know what stigma is about, they can watch Philadelphia. And this is the message I often give to younger people who want to know, what it was like. I wanted to comment on a couple things that, first of all, what Karen said about seeing people dying alone of COVID-19. I mean, I think of the kids I took care of out at Sherman Oaks, who came from out of town, who had no family there, who died alone in those little rooms and with little in the way of comfort. And I wanted to, getting a little far afield here, I wanted to comment on what Diane said about CDC. I saw a quote recently from Don Francis. It was in Maureen Dowd's column in the New York Times. And he had been given, he was at CDC at the time, and he'd been given direction from his higher ups in Washington that CDC should look pretty and do nothing to address the HIV epidemic.
Wow.
Look pretty and do nothing. And at least CDC today is taking a stand. I would point out that Bob Redfield, who is currently director of CDC, is an HIV doc. And I disagree with him, his politics in a lot of ways, but at least he and Tony Fauci seem to be taking a stand and doing the right thing. The last thing I'll say, again going to far field, is that Deborah Birx, who I don't know, in the first several news conferences tried to speak to her experience in the HIV/AIDS epidemic, and she didn't get any traction. And people weren't interested in that because they just weren't interested. They didn't see the connection between these two epidemics, and she abandoned that tack. So I think it's a good thing that we're talking about this, because we do have experience that people should know about.
So
I'd
what is your feeling about her? I mean, Fauci has emerged as this kind of hero. Well, we're all kind of confused about Dr. Deborah, if you will.
Yes, I think she's, I think they're in a difficult position. I think she's bent a little more to cover for the liar in chief compared to Dr. Fauci, who was experienced at, taking people head on. He's a pretty strong guy, like a general.
David, what were you going to say, David?
Yeah, I'd like to bring up the word community. I think it's interesting looking back, whether you look at progressive nursing, Project Angel Food, Search Alliance. I mean, a lot of the organizations, progressive nursing, we tried to get payment for insurance and got denied because home health, hospice, you needed to be Medicare certified for people over 65. And it was Harvey Levin and myself that took them on TV and said, these people are young, you have to cover it. The same way with Project Angel Food, Meals on Wheels said, you have to be over 65. And we went, but they're not. And there was a community that started these organizations with Mary Ann and Paul Rothman and people. It's interesting now, I have a grief group that I started after we were all sheltering in place. It's about 15,000 people. Many of them have had loved ones die from COVID-19. And I say to them, hey, I'm just curious, someone will mention they don't have money to bury their loved one. They weren't able to see their loved one. And I'll go, what's going on with all the COVID relief funds? I mean, I see a $20 million fundraiser, and I go, where's that money going? Are you getting that money? And they're like, well, we don't know. And I'm like, why aren't you asking? And it makes me think about, we had a community, it affected one community that banded together and said, wait a minute, we're not going to take this. Whereas with COVID, it doesn't affect one community that can band together, which makes it even more dangerous. And the penetration is more insidious, I think.
Mm-hmm. That's a good point you bring up, David, is that when we were at that place where the CDC was just sitting there looking pretty and the FDA wasn't responding, that was the impetus for ACT UP to actually form itself to try to move the drug approval process through earlier. And Diane, I think you were really involved with John Vandekamp's orphan drug bill about that time. What was that? What was that, and how did it operate?
Actually, I even remember the number. It was AB 1954. And it was, John Vandekamp was absolutely amazing. So he was Attorney General at the time. And we had a group of people that would meet once a week that we called the book club. But we didn't meet to talk about books. We met to talk about what are we going to do? This is horrible. It's a nightmare. And so the idea came to us, since the feds wouldn't do anything, to try and see if we could get a bill passed through the California FDA. It has its own little organization, and see if they would go ahead and allow us to have drugs tested here and then sold in California. So we went to John Vandekamp because he came to the book club to talk to us, and we asked him, could he help with this? And he said, let me look into it, and he did. And so he put us in touch with his staff. If the drug is manufactured in California, I don't know if this law is still in effect, but then And Jonas Salk thought he had a really good treatment for HIV. And so John Van de Kamp, we get into end of closed session. He had his people write the legislation. He found someone to introduce it. His office helped to sponsor it. We went with him to Sacramento. We met with the governor. He said to the governor, I don't need credit for this. I don't care who gets the credit. I just think it needs to pass. Will you sign it? And the governor said yes.
Who was that
And
governor?
Was that Pete Wilson or Duke Majan?
it was Wilson. And so we went ahead and at the very end, 2 days before the session was over, the bill passed both the Assembly and the Senate, and Wilson signed it. And then unfortunately, Salk, who was working on a treatment, it was not effective. But the only person out of Congress that objected to the bill was Dianne Feinstein.
Wow.
She wrote a letter. She wrote a letter to Wilson. She wrote a letter to Wilson saying, do not sign this. You cannot take this right away from the FDA. This is a big mistake. I didn't talk to her for years. Well, yes, I do take things personally when it affects people I love and care about, and I could not bring myself to talk to her. Now we talk, but I couldn't. It was the worst.
I want to ask.
Don, I want to add something to what David said about his grief group and the lack of people stepping forward. Where's the community to help with the resources? And one of the things that we do know, and there's a great book if you haven't read it, is called Bowling Alone by Robert Putnam, who's a social scientist at Harvard University at the Kennedy School. He wrote a really important book a number of years ago, in 2000 actually, it's that long ago already, about the decline of the social fabric of America since 1950. Part of the reason, David, I think we're not seeing the same kind of community efforts to help in the same way that it happened during the HIV beginning of the epidemic, is that our entire social fabric in America is completely frayed in a whole new way. And people aren't in communities in the same way. They may feel like in a more general way, oh yeah, I'm part of the LGBT community, but they're not necessarily dialed in the same way that we were interwoven with each other. We see that in the diminution of religious institutions and the diminution of political institutions in our country. So it is a serious issue, a lesson to be learned out of how we all helped create communal responses in the early days of HIV/AIDS, that we provided resources for one another. Who is going to step forward now to help all of those who are struggling, the families that are mourning, the people who don't have the money to be able to bury their loved ones? We don't even know the lasting impact of if when you contract COVID-19. It's not just, oh, you get it and you get better. There seems to be at least growing, emerging evidence. Dr. Gottlieb, contradict me if I'm reading this wrong, but that there seems to be lasting issues that happens in one's body when you contract the virus. So I think this is also a difference in the two periods of times, and something that needs to be given more voice to and discussion about is that breakdown of institutional life.
You know, one other thing, oh, go ahead, sorry, go ahead, Phil.
No, well, I actually, this is one of those cases where I absolutely agree with Denise, but I also want to put another spin to what's going on. In part because, quite frankly, I need to have a positive spin. One of the things that I think is going on around COVID-19 right now that should not be underestimated is the impact of sheltering in place. You know, we could physically come together. We could physically do a protest. We could visit our loved ones in the hospitals and the clinics. And that experience actually also created community. Literally today, and then I'll get to my second point. Literally today, my mother is being released from the hospital. after being in the hospital for 8 days. And thank God it was actually not COVID related. My mother is 84. She was actually in the hospital for non-COVID related pneumonia and congestive heart disease, which are two of the things that happen with people who have COVID-19. But in her case, no, she did not have COVID-19. And the isolation that she felt, that she was in the hospital and no one was there. And normally when my mom goes into the hospital, we rally around and provide 24/7 care for her. And the fact that, we called an ambulance to come pick her up. They wouldn't let us go with her to the hospital. She got in the ambulance and we did not see her until this afternoon when we picked her up. And had things gone south, and there were days when they very well might have gone south, we would have had to go through that process with her totally alone and with us totally alone. And that is so debilitating. So I think that those two factors are things that kind of are impacting kind of the lack of community building that's going on. The second thing, and this speaks to stigma in some ways, but it's a different thing. And Denise, maybe you can speak to this because I'm sure, and David, you as well, because I'm sure both of you also have experiences with the elderly. But the relationship between HIV and COVID-19 is that how we value each other, and that gay men were not valued, Haitians were not valued. And so the kind of global community mobilization didn't happen because they were disposable populations. Today, quite frankly, the disposable population are elderly people who are shut away anyway. We put our elderly into these nursing homes, which are god-awful places, by the way, having experienced that with my mom as well when she was in rehabilitation. And they're dying alone, and they're forgotten even before they get sick. And I think that's another factor that's going on. In fact, people have said it, the liar in chief, the Orange Menace has said it, when the reason why you can open up the economy is because the people who are dying are older and they're not engines to the economy, which is actual, if you unpack that, that's an absolutely horrible thing to say. And I think that those are factors that contribute to some of the difficulty and why we're not seeing the kind of response that we've seen in other points in time.
And let me add one more factor, and then Denise, I'm sure you'll have a lot to say on this too. The other thing is that's so in contrast is think about how all of us saw each other literally every weekend, if not every week, at a funeral. In COVID-19, 100,000 people have died, and there's not weekly, daily funerals. If we saw 100,000 caskets, it would change everything. But because of the shelter-in-place rules, it's easy to make them the forgotten grievers and not visually see what happens. And funerals, bring people together and give them a cause to fight for too.
That's absolutely true. I've done a few funerals in this time, and of course there's only a few people allowed, and they're only at the graveside. There aren't the rituals, whether we had funerals or in the days of HIV, people weren't necessarily religious. We had celebrations of life. We had big gatherings, to memorial services and parties to celebrate and to remember. So important. And David, you've taught us all so much about that process and needing to make meaning, as you've called it in your book. But the other thing, Phil, this disposability of seniors, it's also in the shelter-in-place time are the exact people who often don't have the ability to hook into the technology that we are using to create. I have to tell you, the efforts that we've had to make in our congregation for some people in their 80s and up who don't know how to use the technology, who still refuse to use the technology, who still don't have an email address, who can't we've been having worship, we've been having lots of education programs, but they can't even access it. So it's a double distancing. Not only are they isolated because they're seniors, they can't go out, they might be in a residential care place, but then they don't even have the ability to connect to whatever community they might have because they don't have any access to internet. And this is also an issue of the poverty cracks that we see, where people don't have internet, they don't have technology to be able to even connect in the ways we're connecting right now. And that is something that's also so critical for us to remember in this time.
Let me open up another kernel of thought for everyone to discuss around harm reduction. During AIDS epidemic, we had to create messaging around safer sex, using condoms, getting people to change their behavior. And at the beginning, nobody wanted to wear a condom. And we were told we were anti-sex, and this was contrary to the sexual revolution, and how dare you tell us what to do? And we're seeing some of that play out now around masking. Masking is now the new condom debate, right? People fighting over whether to be masked or unmasked. Are you more manly? Are you less manly? Who are you protecting? You're protecting yourself, protecting others. And I think there's a role in there for some harm reduction rather than absolutism, which is just forcing people into different corners of the room.
And John, you started a point down the timeline that I want to bring you back a little earlier than that, because actually, even the first conversations about condoms was harm reduction. We didn't label harm reductions at that point. No, but I remember several times. No, because you may not remember, but I started a workshop called Hot, Horny, and Healthy, teaching Black gay men how to have sex in the age of AIDS and ARC. Now, before we use the language of HIV. And I remember many times being on panels, where folks would say, how can you be talking about gay men having sex at all? That it was abstinence only was the conversation, even before we started talking about the things that happened later on in rural school systems. And so the whole notion about harm reduction and the way I like to think about harm reduction is that we were forced to consider sustainable prevention strategies. Now, and this is an area that we can be extremely helpful in this current pandemic, helping people understand both the importance and how to develop sustainable prevention strategies.
But I don't think that we're being very helpful in teaching people how to have sex in a pandemic, because I can tell you, one of my neighbors has tricks coming in all the time. And not only are they not wearing masks, but they don't know each other. I mean, I don't know how they found each other. John and I had a conversation about this, and actually he posted on his Facebook page about having sex in a pandemic. And one of the harm reduction strategies, if I remember correctly, John, was saying having, picking one or two people that you trust to regularly have sex with. But, folks are asymptomatic. It's just like back in the day. How do you tell if somebody is HIV positive? Do you ask them? What if they lie, et cetera, et cetera? So I think that, having sex in a pandemic is a very big issue that we're not really discussing honestly, forthrightly. And I fear that it's, the stigma around that is going to kill people, frankly.
But Karen, even before we get to sex in a pandemic, we can talk about harm reduction around grocery shopping in a pandemic when we're talking about COVID-19, about any sort of social interaction. So the concept of harm reduction is extremely valuable, whether we're talking about the kind of intimacy around sex, or whether we're talking about the whole notion of social and physical distancing in any endeavor that you might engage in. For example, I'm in Chicago right now, and I had to figure out harm reduction strategies to get from Los Angeles to Chicago to visit my 84-year-old parents who have underlying health issues even before COVID-19. No, diabetes and heart disease and kidney disease, et cetera, et cetera, et cetera. How do you do that? Not to mention, sadly, I also fall into that senior category as well. So I have to worry about my own health around harm reduction. So I think that the lessons that we learn, yes, with HIV, it was primarily around sex, but the notion, no matter what the principles of sustainable prevention strategies are things that we know how to do and we can help in this environment.
I might
we-
jump in.
Go ahead, Michael.
Thanks, Diane. I might jump in to say that Dr. Birx, actually, Karen, has tried to emphasize sustainable harm reduction strategies, but she's standing up there and she's wiggling a little bit and she's being undermined as she's doing it by the guy who won't wear a mask. I mean, she's being undermined. Her message is being undermined. But, and in her first presentations, she drew the analogy between harm reduction strategies and HIV. So we have experience in harm reduction. Nobody wanted to listen to her. But harm reduction is more than just masks. It's about social distancing. But this period of a couple of months perhaps is an opportunity for people who are inclined to learn, as Phil did. He had to think before he did things, and he had to construct a harm reduction program for himself. I don't think the general population, certainly not the folks at the beach, are doing this. And unfortunately, that is what it is going to take, is to be careful in an ongoing way.
There's a real political issue here, okay? First of all, we have to think back, and even today, how people feel about HIV in this country, okay? There is still such a stigma attached to HIV and AIDS that people have, I think, who don't understand, didn't lose someone, and weren't even alive when it happened, for a great deal of them, that they don't really respond to the comparison. That's the first thing. And then there are those who were alive and their response is negative. They do not want to be compared to people who are dealing with not converting to HIV positive. That's a very bad connection for them, especially if they're not out of this community, our community. So that's the first thing. The second thing is that we have an administration that doesn't set an example, and that from the very beginning has made it seem like those of us who are strong, especially men who are strong and powerful, don't need a mask, okay? So if the person who's supposed to set the example doesn't set the example, why would people who believe in him, I really do believe it's a cult, his cult following, they're not going to do that. They're not. My feeling about it is that the way that we get people to be safe is to appeal to women, because women are the mothers in this world. And if they get it, and I see it in friends of mine who are married to men, that when women say, honey, you have to wear a mask early. I mean, I'm talking about a month ago, when they didn't want to, when they were out working and they didn't want to wear a mask. But when women say, you need to do this, you need to do it for your parents, you need to do it for your children, you need to do it for me, if you love me, that's how we get the message across. I think that's the politics of it. Do I like the politics of it as I see it? Not especially, but I recognize it. And from a strategic perspective, how do we get people to do what they need to do to keep themselves and everyone else safe? I think that's what we have to be looking at. That's the question.
Let me ask you all about an irony. So here's an irony. Back in 1986, Lyndon LaRouche introduced an initiative, Proposition 64, for a mandatory quarantine of persons who were infected. On the issue of testing, of course, we were opposed to testing at first unless it was anonymous, or we used identifying numbers rather than names. On the issue of contact tracing, we were so afraid about county health officers contacting our people that we had to create our own systems. These are all tried and true traditional methods of controlling contagion and disease. We oppose them all. Now it seems like we're supporting them all. And we are supporting testing, contact tracing. There's no counseling component to any of this, and actually quarantine for 2 weeks. Is it just the fact that this epidemic is so much different from the last one that we need to double down on those traditional methods? Or is there room for nuance from the lessons we learned last time?
I think we would have allowed it back then had we trusted those in power.
Yeah.
Well, I also think, and Michael, I'm sure will jump in on this, they're different pathogens. I mean, that COVID-19 is airborne. Now, HIV is not. And I think that while the examples you cited, John, are stark, our position was always around what are the best strategies to get to the end goal. And the end goals were, prevention, access, and utilization of treatment. And those tactics, those quote unquote traditional health tactics in an HIV context, were not appropriate strategies in that context. In part because of a different overwhelming level of stigma and demonization that was beyond even just the trust issue. It's this thing that just because I'm paranoid doesn't mean that I'm wrong. That one of the reasons why we didn't have trust is because the institutions were not worthy of our trust. That they actually there was documented cases of them doing harm. And to perpetuate that harm would have undermined our efforts around prevention, access, and utilization of treatment. In COVID-19, I think that A is a different pathogen, and I think it's a different context.
But I also think there's a political and civil rights issues that we have to pay attention to. I mean, 25 years ago, we've made progress in part because of all of the politicization and the work that many of you have done to create protections for people, for LGBTQ plus people and people with HIV. We didn't have trust that we couldn't have been kicked out of a housing at that time. And there's still places in the United States, of course, that don't have the protections that we have here in California. But a lot of those protections that we now have are put in place to be able to say, okay, let's be out and open that we're LGBTQ, exactly what Karen was talking about earlier, because we have those protections that really often grew out of the HIV/AIDS era and the work that many of you did.
One of the other things is fear about accessing healthcare. I mean, look at who is being hurt the most, frankly. Latinx and African Americans, the Black community, and also people who are impoverished or, of low income. And a lot of that, what I've been seeing from the Williams Institute and other places is that there is a fear of going to the hospital until you're very, very sick, and then you go to the ER. But in our community, a lot of it is still around the stigma of homophobia. So it's like, I don't want to go. Prior to COVID-19, we had an STD crisis, an STD epidemic happening. I suppose that's just disappeared now. Well, maybe not, but a lot of people are afraid of accessing healthcare because they're afraid of being outed. They're afraid of culturally incompetent doctors. I mean, that's one of the things that Michael and Joel did very early on, was create this sort of cultural competency where we, in fact, started having AIDS doctors. Let me report on this. Equality California has in fact created a page of resources for LGBT folks to access precisely because of this fear. And one of the things that Rick Zuber was telling me is that they created this because the government is not stepping up. I mean, talk about catch-22s. We need LGBTQ data in order to go to the government to say, here are our needs, give us these resources. And the government says, okay, what's your data to prove that there is a need so we can provide the resources? And they're not collecting the data. So in the meantime, Equality California, of which Diane and John know a lot about, have stepped up and are providing links to resources. They're going to put together some sort of a list of all the different providers, et cetera, et cetera. But for those who have access, you know, and maybe Denise, you can refer some of your folks there too. You know, that is a place to go if they're afraid of the healthcare system at large.
Dr. G, did you have anything you wanted to say
I
about
wanted to jump in about your point about the acceptability of contact tracing in this current context and why it was unacceptable and testing was viewed scant, you know, during the early time of HIV. And I totally agree that the institutions had to be established, the protections had to be established before, you know, testing, you know, could be instituted with HIV. But I think everybody on this panel would agree that, you know, if they tested positive for COVID, they'd be okay with contact tracing. But I think there's a large segment of the population, perhaps the members of the cult, who would not be okay with contact tracing, who see this as the intrusion of big government to the max, and who would not be cooperative with public health investigators. And then you have people who are undocumented, who might be at increased risk for COVID-19, who would not be comfortable with contact tracing. So, you know, we are enlightened on the subject, and it is time-tested public health strategy, but I think there will be a population that rejects it for political reasons largely.
I also think it's interesting to look at the language we all know because of our past. You know, I was tested for COVID and I was negative, and I said to people, I'm negative today. And they'd go, what do you mean today? And I said, well, it's a snapshot. It's today. It'll change once I go into a grocery store. And they're like, we don't understand. Or I would say things like, it's a virus. It doesn't know state lines. It doesn't know groups. We all know that from our past. The same, I was having a couple of people over the other day. We were all social distancing. And I said, you got to remember, you invite one person over, you're inviting everyone over they've been with. And my son's like, what do you mean by that? And like, we all know what that means. I also think it's interesting, the idea of resilience. Resilience, as many people know, it's like a muscle that we all have. We really, in the age of HIV, had to grow that muscle. And it serves all of us now. Whereas I think so many people who haven't been through tragedies, epidemics, whatever it may be, haven't had the time to really grow a resilient muscle to combat a lot of the things that we had to work with back then.
Very good point. Let me, I'm going to open another bubble of thought.
Well, actually, John, before you change subjects, I didn't know you were going to change subject. You know, I was very struck, and I've been thinking a lot about this issue of resilience, but I'm also worried about something else, David, that I think we need to really pay attention to in our community in particular. And that's post-traumatic stress syndrome.
Right.
You know, and that, yeah, we have resilience. But I have to admit that watching this happen over again, you know, I was 24 when HIV entered my life, or AIDS actually entered my life. Actually, GRID entered my life, to be precise. And I'm 64. I was 64 on April 22nd. Okay. And I have to tell you, I worry about my resilience and about my friends' resilience. I'm tired. Watching this happening again is very debilitating. You know, all of you who know me know that I am a massive news and political junkie, and I have to be honest, I can't watch CNN or MSNBC more than an hour a day, because it totally incapacitates me.
But I want to add to that, looking back at it, I think you're so right. I agree. We have to worry about that. But I think it speaks to what you learned. One of the things I would say is probably true about all of us and many people here is that we are having more post-traumatic growth that came out of our world. And that's what I've been studying a lot, is post-traumatic growth. And you being able to set limits is something you learned. And I think people don't know some of that stuff now. And so I worry more about them, the younger folks, than us.
This is a good segue to the next bubble of thought I wanted to bring to the group, which is the anger and the angst. It is probable in the next 3 to 6 months that there'll be high rates of unemployment, people not going back to work, feeling desperation, not able to feed their children, not able to pay their rent. Those are the ingredients for social rebellion, revolution. And in the AIDS epidemic, we saw that anger and angst come from the left. We're seeing it now from the right. And maybe the difference is back when we were doing it, we were really, I think, trying to be helpful. I think the anger we're seeing now is just being obstructionist and defiant for the sake of being defiant. But as this continues to grow, is there a place for those of us that have walked through this before? Because Search Alliance, Aid for AIDS, AIDS Research Alliance, Project Angel Food, all of these organizations that we were all part of came out of that anger. It had to be funneled somewhere. And we funneled it into creativity, innovation, and a way to get on top of all this. Is there a place for that anger that's going to probably happen to people in the center, maybe by the time the fall hits, for us to help guide it a bit so that it's not just all anger on the right to help the November elections, but actually become something useful for the upcoming years as we're all going through this pandemic? Just some question and thought.
I don't think that I think the anger is a result of fear. And that when people are afraid, and whether they want to acknowledge that they can get it or not, there is almost in everybody an underlying anxiety that is a fear. It's an unknown, you can't see this enemy. And so what do you do with that? And I think it turns into having to strike out. And that what we see in these people is this anger, which is fear-based. Why isn't this getting better? Why, or since it's not, and their leader says it's really nothing. And when you look at the numbers, that's the other thing. You look at the numbers and they say, oh, well, sort of goes back to where we started about when HIV first came. And the numbers of people who were infected were relatively small to the total population of the gay community. I think that people today, in some ways, they're betting their odds when they don't wear a mask and they don't social distance. They look at the numbers and they think of how many million people are in the United States today? Over 500,000 people. And they say, but it's just a small percentage of those people who have gotten the virus, and an even smaller percentage of those people who have died from it. And so when I look at those people with their guns and their knives and their anger, I realize that if I could look behind that, I would just see incredible fear for themselves, their jobs, the economy, their safety, all of that. So for me, and I know it's been suggested, I'd be interested. So I limit my time with CNN or MSNBC. I really do. I can't, honestly, Phil, I can't even do an hour sometimes. It's too much. It's too much. But when I look at them, I think to myself, what can we do? Well, so I don't remember who suggested it, that we do what FDR did. And the situation in Michigan with the 2 dams that failed, which were leveled high risk before they failed, I think that that's exactly what we need to be doing. I absolutely agree with all of the programs that are out there, and that will be to help people financially so that they have money to buy food and eat. But I think that part of what happens when you're home all the time is that you're isolated, and so it becomes even more fearful for you, the lack of human contact. We need to be starting to put together and start to build our infrastructure. When this starts to be under control, we need programs, federal programs, money to the states to fix bridges, fix dams, fix levees. And as soon as we get money out and circulating in society, the economy will improve. It's not going to be overnight, but it's going to happen.
Anybody else?
Yeah, I don't have the option of not watching CNN and MSNBC. I have tried to limit it a little bit, but not often. I did experience binge watching yesterday, though. That was interesting. The thing that I fear is with this cult is our numbness, because there are all these numbers. You can even have the juxtaposition of Donald Trump playing golf to Memorial Day, and people sort of shrug. As a matter of fact, talking about FDR, it's like, don't change horses midstream. That's very frightening to me, that, between the numbness and the sort of need for an autocrat because of this fear that you're talking about, I'm not sure I wish I had resilience. I wish I had all this hope and faith.
Karen, you've got a lot of resilience, let me tell you. To do what you've been doing these years, everyone here has a lot of resilience, believe me.
Well, I was thinking the anger is associated with grief too. Isn't it one of these stages of grief? Isn't that
absolutely, absolutely? And I also think of, kind of what Diane was saying, anger is pain's bodyguard. It's fear, anxiety underneath. That's really what's there. It comes out as anger.
Yeah, but if it's a stage, that's good.
It is a stage. It is a stage.
Well, I think that.
Oh, go, Phil.
I think that anger can manifest itself in different ways. I think that the anger that's coming out of, white supremacy and white privilege is what we're seeing a lot around COVID-19. But there's a different anger. And I think the anger that we express around HIV and AIDS, and that we can help the world today learn to express, is the anger that triggered us into action. The realization that, as they said in South Africa, we were the ones we've been waiting for, and that no one can save us but us. And I think that we understood and we understand that now. And I think that even within our community, we can be a critical player in helping the larger community to connect the dots. We already saw in 2018, you're right, Karen, that you have to be worried about numbness, but I don't think that is the prevalent reaction to our political environment today. I think that there are many, many, many people who are mobilized and can be mobilized. We know how to do that. We have those skills. Now, the time has come for us to be called back into duty and for us to recruit other people to come to come in to be engaged in that way. You know, there is a direct relationship between, you know, the mismanagement of COVID-19 and who is currently the resident in the White House. And if we want for that to change, we need to change leadership and we need to connect those dots. Now, and in all these maladaptive activities that are happening in our societies and attacks on our institutions, they really are about, you know, the nature and the sources of leadership. And I think that, you know, we can play a role in that. I mean, I absolutely believe that we totally changed the concept of research and medicine and care and delivery for the planet. Now, and in the service of the planet, whether it has to do with HIV or not. You know, I see it with elder care with my parents right now. No, we saw immediately what happened with cancer, now particularly breast cancer. It's as if they took all, they went in and did a mind meld of the HIV movement. And so we have those skills. We know how to do that, and we have an obligation to do that.
Yeah, and Phil, you're talking about using anger as fuel.
Right.
We knew how to do that. Sorry.
No, David. I also think in this conversation today, we have to realize we're just a few months into it. Think back to when we were just a few months into the HIV/AIDS and ARC, when we were, you know, we've got
grid.
Grid, exactly. We've got years of hindsight, and I'm still hopeful that if we veterans of this pandemic the last time can continue to talk and mentor younger people. And that's why having this available, John, you're doing such an importance for the city of West Hollywood to be able to share the wisdom that we have learned, to mentor younger people to be able to go out, even if we are older now and maybe don't have the bandwidth that we once did, Phil, when we were 24, me included, but to be able to help them take the same feelings that they have. They're out of work. Our young people have greater college debt than we ever imagined. They're the first to go in furloughs and jobs, not just us. So I think we have to help them shape and give authentic voice to their generation and help them transform. And I think we're yet to see what's going to happen months, a couple of years, because this pandemic isn't going to be over, as we heard earlier. Even in 18 months, if we could get out a vaccine tomorrow, it's going to take longer for us to manage the risks here.
This is a good
John, just one thing.
Yeah.
Did anyone see the demonstration by ACT UP in New York over this past weekend?
No.
It did my heart good. Okay, it really did, because ACT UP was so effective during the HIV/AIDS crisis. And there they were, and they had this big sign, and it said, "The president lies, people die."
Yes.
That was the same slogan we had 30 years ago.
Exactly.
Yeah.
And there we are again.
This is a good segue into what I guess I'm going to ask you all for concluding remarks, because we're almost at the hour and a half point. And so, and Denise has already alluded to what I wanted to ask each of you. Young people today are saying, I just got my degree. I have no future in front of me. I have all this student debt. All my career plans have been completely obliterated. I have to worry about getting sick, filling the gas tank. I could die by the time I'm 30 years old. You know, my parents, I may have to bury. My entire life has been turned upside down by this. And I don't even know if it's worth it. And I remember back when I said the same thing when I was 24, like Phil. Or when the late Dr. Hitt told me, you're not going to live to see the year 2000, John. It's not going to happen. You know, and something happened in me and in all of us that made us live life from a different place than before, to give us the ability to live with HIV in our community. How do we share or impart the wisdom or the instruction on how to live with COVID-19 in our community for the foreseeable future? Or any other concluding remark you want to make?
I will add to that, that I will just say it's a tough conversation because I do feel like every generation gets something, whether it's AIDS, the Vietnam War. I do think young people get horribly challenged in their life. And I think this may be, you know, one of the generations, and there's a naivety about youth that, like, not your generation, you're going to be fine. And all of us get wake-up calls. And it is a time for us to sort of be elders and mentor them and reassure them that there is no storm that doesn't pass. There is no night that doesn't give way to day. And we're all examples of that. And it's just an honor for me to be here with all of you. So thank you.
Thanks, David.
I couldn't agree more than what David said in terms of providing guideposts for hope and resilience, and to teaching people that muscle, as you said, David, for resilience, that to put one foot in front of the other. This is, Karen, what you learned so well in the 12-step program, one day at a time. We don't necessarily can't look at the whole arc of our lives. If we had to predict at 24 and 28 what we were going to look like at 64 and above, we might not have ever been able to imagine it. Just like these young people today can't imagine what necessarily the world is going to look like or their lives are going to look like. But that's our job as teachers, as parents, as mentors, as grandparents, to help them have a sense of their own flight, to be able to take wing and to give voice to their anger and their righteous indignation and help them channel it in a way that will transform our society. We did it in our time. We're going to help them do it in their time, in this time. And we're not in this group quite all done yet either. So I have confidence that we will find a way to live with COVID-19, and we will find a way, even if we have to be socially distant for a few years, but we will find a way to be spiritually, emotionally connected and together as a community. I have confidence in that.
That's actually the one hope I do have, especially for the younger generation, because what I'm seeing is, in 12-step terms, we talk about it in terms of being of service to people. I've seen a return of civility and kindness, and they don't necessarily call it, they say thank you for your service, but they don't necessarily see how their own sharing and helping each other is being of service too. That's a spark, a glint of hope that I see of all these young people who may have this debt, but the concept of debt is kind of put on the shelf for the time being. Somebody, their neighbor, somebody they found online, they come up with these imaginative ways to help. And that to me has just been incredibly heartening. I mean, I have to confess, I've been really triggered. You know, my PTSD has kicked in. I'm sitting here with my dog, and there are one days at a time when I just am very grateful for having my dog. But then I see these kids, you know, creating cookies, or, you know, the teachers are passing by in caravans to share this whole concept of, you know, the graduating class of 2020. I mean, there's a kind of a freshness and ingenuity, a kind of a seeking of a way to have hope. And a lot of that is by way of sharing. And that's coming, a lot of that I'm seeing bubbling up from younger people. So that does give me a lot of hope. They're helping me.
The thing that I would say is to a young person is that I got my first real career job after university in 1980. And the MMWR in 1981 introduced grit into our world. You know, I was one of those kids. I just got my first real job. And I was diagnosed in 1985, finally. I was probably actually infected in 1980 when Chris and I met. And Neil Schramm said, go and get your affairs in order. You probably have 6 months to live. And I remember thinking, you know, I'm 36 years old. I don't have any affairs to get in order. And so the thing that I would say to a young person is the best way to get through life is to live. And the best way to work through your pain and your fear is to act and to serve. And there are many days over the last 40 years that, you know, I was an activist, not because I was a particularly good guy, but it was because it reminded me that not only was I still alive, that I could live. And so that's what I would say to a young person.
Dr. G, you want to go ahead?
I would jump in to say that I think there are a lot of young people who could potentially feel helpless under these circumstances and hopeless under these circumstances as well. And kind of we felt that way. Many of us felt that way back in the early days of AIDS. And I think that, you know, we became involved in a movement to make things better. And there's so many things that were created, Aid for AIDS, Project Angel Food, APLA, the Center, synagogues and some churches jumped in to make things better. And I don't think that we're finished, as Denise said. I don't think we're finished, and that we can contribute to this. And we have to think about how people can band together and form some kind of community, as Phil was saying earlier, some sort of community to address this and to make it better. And that's going to take change.
Diane?
I think that, first of all, it is perfectly normal to have days when you feel that you just can't do anymore. And sometimes life gets so overwhelming, especially when you're not expecting it, that you're going to have days like that, and you can't be hard on yourself. And sometimes it feels like you yourself alone, you can't make it any different than what it is. But you can. You can make it different. You can understand that a change can be as simple as making sure you vote. A change can be as simple as talking to a friend who is also feeling terrible and looking and saying, yeah, this is really terrible, but what are you doing for dinner tonight? What are you making? That it doesn't have to be heroic and it doesn't have to be big, but you can make a change. And if you're unhappy, and believe me, you have every right to be with where we are today, then you could look at who you really want to represent you. I bet young people especially don't even know who your representative is. But you're also smart with the internet. Just go on. And yeah, you don't have any money, but you could volunteer to make calls. There are things that you can do and we can do together. And if you can do that, maybe you can get 5 friends to do that, and 5 more and 5 more. And you can make a big difference. And that's what I would tell a young person today. And you know, I really get what you're saying, John, because I spent so much time at Sherman Oaks Hospital that one day I pushed that button and I thought to myself, what am I doing here at my age? What is someone who is 30 years old? My parents go see friends in hospitals. Rarely, by the way, but it is a sobering thought. And so I think for young people especially, they feel so cheated. That the hope, I think, comes from acknowledgement and encouragement. And I want to say that it has been such a pleasure to see each and every one of you. It has been so long, and you have all done so much, and we've worked together. And I'm so grateful that you are all still here. And so wise.
Thank you, Diane. Thank you. I guess I would just thank you to everybody for what you had to say. You know, each of these panelists alluded to it earlier. I just want to repeat it because it's worth repeating. If you're waiting for somebody else to show up to do something, don't. Nobody else but you. That's what I would say. We walked into this last epidemic. We changed everything. We questioned our doctors. People didn't question their doctors before. We read the same materials that doctors read. People didn't read those sort of textbooks before. We raided, blood banks and demanded they do something different. We challenged insurance companies. We challenged the Pope, the President of the United States. We didn't care. We were fearless because we had nothing else to do but to respond, given that we thought this was going to be it. When I gave up the thought of having a whole lifetime and just had a life instead, what did I develop? Something meaningful. The virus doesn't have emotions. The virus doesn't have thoughts. The virus doesn't have any beliefs about anything. The virus does not have a story to tell. You and I and we have stories to tell. And there are stories yet and they're about to be written about this. So I want to thank all my colleagues. Phil, did you say something?
And on the road, you had a lifetime.
And on the road, I had a lifetime. Thank you for the final quote to that otherwise brilliant quote I was constructing. It needed that dot on the I and the cross of the T. Thank you, Phil. I want to thank, these are all some of my dearest friends, colleagues, because we have all been in the trenches before. And as Denise said, we're still here. We're not quite done yet, but we're willing to work alongside with so many others who are now being called into action. David Kessler, thank you for everything. Rabbi Egger, Diane Abbott, Phil Wilson, Dr. Gottlieb, Karen Oakham. And I want to thank the city of West Hollywood for recording this and hopefully publishing it widely. And I hope it's useful to all of you at home who are home watching this. Thank you all. We'll see you all very soon.
Thank you, John, for doing it.
Yeah.
John.